Welcome to Trinity Health IHA Medical Group Wednesday Wellness Series. This presentation is titled The Breastfeeding Journey, Empowering Parents with Knowledge and Support, and the presenting providers are Trinity Health IHA Medical Group Pediatric Nurse Practitioners and Lactation Consultants, Emily Piniatoglou and Kelly Strickler. Both Kelly and Emily see patients at our breastfeeding medicine practice on the campus of the Ann Arbor Hospital. Kelly is going to kick it off for us, so welcome, Kelly.
Thank you so much. And thank you everybody for being here tonight. Emily and I are super excited to have you. And Emily, I think, is going to advance the slides. Perfect. Okay. So we just want you guys to know a few statements up front. So we support breastfeeding, chest feeding, pumping, use of donor milk from milk banks, formula feeding, pretty much any type of feeding that is safe. So we know that babies can be fed in a variety of ways. There's not one single right way to do this. And we find that many families choose a combination of breast bottle feeding, and sometimes there's a third option in there. We're assuming that you're here because you want to maximize your breastfeeding or pumping journey, whatever that may be, or it could be bottle feeding formula. We want to set you up for success no matter where you are in your journey. And although, of course, we support everybody who wishes to breastfeed directly, but understanding that we are in a medical setting and clinic, and that we know that fed is best. So sometimes there's going to be times where supplemental feeds are going to be necessary, medically necessary. Those would include low blood sugar, a preterm infant, significant weight loss, jaundice, or any other medical issue that would warrant supplemental feeds. And as parents, you would definitely be alerted to those, and there would be a discussion with your provider to determine, when this might be necessary and sort of what that pathway might look like. Mother's milk is always the first choice, if possible, with supplementation. Next slide, please.
Stuck. So let me just see why we're not moving forward.
No worries.
Sorry about that.
That's okay. Okay, so just what we're going to cover today, the benefits of breastfeeding, preparing for breastfeeding prior to delivery, what to expect in the hospital after delivery. You go home, now what? That's a really big question. Myths versus truths, some bumps in the road, which are totally normal, and then where to find support during your lactation journey. All right, so this is one of my favorite slides, best breastfeeding benefits for mother and child. There are so many, but breastfeeding is good for both you and your baby. Breast milk's the best source of nutrition for most babies. As your baby grows, your breast milk will change to meet their nutritional needs. Breastfeeding can also help protect mom and your baby against some short and long-term illnesses and diseases. So this is actually a very short list, but benefits to the mother can include protection against breast cancer, ovarian cancer, type 2 diabetes, and high blood pressure. Many benefits to the baby, including possible protection against or lower risk of asthma, obesity, type 1 diabetes, severe lower respiratory disease, ear infections, as many kids get, sudden infant death syndrome, and a lot of sort of GI type illnesses or infections. And like I said, that's just a short list. Thanks, Em. The American Academy of Pediatrics, whom we follow, and the World Health Organization recommends exclusive breastfeeding for the first 6 months with the addition of complementary foods when appropriate, at the time appropriate that you will discuss with your pediatrician. Breastfeeding should continue, for up to 1 to 2 years of age, or as long as it's mutually desired by mom and child. We see all kinds of different lengths of breastfeeding or pumping with our dyads. All right, so let's get to planning for your breastfeeding journey. So one of the things that you can do is educate yourself about breastfeeding lactation by taking prenatal breastfeeding classes, attending this lecture, talking with other providers, talking with friends, family. We do kind of say, try to stay off like the internet. Sometimes that can lead you down a rabbit hole that maybe isn't medically true. Check on lactation support at your hospital, pediatric office, and the community. Plan to take your prenatal vitamins postpartum. Pick up some vitamin D drops for your baby. This will be 400 units per day. If you're primarily breastfeeding or the baby's taking breast milk, and we can answer questions about that if you have them towards the end, but your pediatric provider can definitely help you out with that. I typically talk about this at the first newborn visit, and then I address it again around the 2-week visit as a reminder. So other things that you might want to start thinking about purchasing would be a breast pump, breast pads, storage bags, a feeding pillow, and nipple cream. We prefer or recommend the Earth Mama or Mother Love. There's lots of different choices out there. We just feel like we get really good feedback from our moms, safe for baby, etc. And then BPA free bottles if you choose. All right, so we do have some specific recommendations. So this is probably one of the most important things is the pump recommendations. There are so many pumps. I mean, even Emily and I mean, it's like, makes our head spin. There's so many out there, but we absolutely love and prefer the Spectra pump. There's a couple of reasons for that, but really this should be your primary pump. It's got a stronger motor and suction. Yes, we have tested these in the clinic than most other pumps. It removes the milk more efficiently. It kind of mimics the baby the best. And to be honest, it's simple. It's simple to use. Some of these other pumps have so many buttons, and you want something that if you're going to be using this frequently, that's pretty easy. The Spectra comes in an S1 and S2, as you can see in the picture there. The S1 is the blue. The difference is that it has a battery. So it's a little bit more pricey, about $100. So some moms prefer that, but you don't have to do that. You can plug in with the pink S1 Plus, and that one is totally fine. They're both great. One of the things I'll just mention that we do in the clinic is we will go over flange sizing with you. We will show you how to use the Spectra. We'll give you written directions. We'll have you practice all those things. Really important also, I know everybody loves the hands-free pumps. It's okay if you have one for absolutely necessary times, but the hands-free pumps aren't going to remove milk as well. They do cause some more breast pain, nipple pain, some inflammation, and they're just not going to get you as much milk. So you can have it as a secondary pump. I have moms that you'll say, Kelly, I'm not going to be able to pump unless I use this hands-free. Then obviously we're going to recommend you use it. But if you have a choice, we want you to sit down, plug in, or if you have the battery one, great, and use the primary pump, which is the Spectra. Okay, support pillows. So the Boppy used to be the pillow that everybody used, and the Boppy is okay, nothing wrong with it. However, this My Breast Friend pillow that is pictured here, we feel like is way more supportive. And I will tell you, and Emily will agree that, most of our dyads and families that come into the clinic, if they don't have this pillow, a lot of them will literally get on Amazon and order it right in the clinic because this is what we use in our clinic, and people are like kind of wowed by it. So if you have a choice, if you're going to, put a pillow on the registry, we would highly recommend the My Breast Friend pillow. So it offers superior support. It's got like a wraparound design on the back that supports your back. And it just kind of holds baby better compared to the Boppy. Okay. A couple of things that we want you to say no to. And I know both of these things are on the internet. They're on forums. Probably lots of your friends have them. But we want you to, Emily and I are going to save you some money tonight. So we want you to say no to that Haka. The haka is kind of, you can see a picture of it, but it kind of is a suction that goes on your breast and it just continuously is a suction. It doesn't give you a break. It doesn't mimic the baby. It doesn't mimic the pump. So what we see with this is we see a lot of breast inflammation. And also we have literally seen in clinic is that moms are having this haka on and then they're removing milk and then they're trying to breastfeed and the baby does not have that milk available to them. So we've actually seen babies who have lost weight due to this. So please just don't use it. If you are a mom who is leaking milk, you have a lot of milk and your shirt's always wet and stuff, you can use the haka ladybug. That's just a passive collector. It just sits in your bra and collects the milk. There is no suction there. And then the other one is silverettes. And this one, a lot of moms have when they come in and we have a discussion. I know they're very expensive. I think about $60, maybe even more now. But we don't love them. So save yourself some money. They cause a lot of inflammation. And if you have any wounds, it can actually lead to like a mastitis and create an infection. So we see moms with breast inflammation, nipple pain, and when we sort of track things back as we do in our breastfeeding medicine clinic, we always like to say, why did this happen? And a lot of times it leads back to the silverette. So please don't buy those. All right. So while you're in the hospital, so of course, this is all assuming that baby is born and does not need medical attention right away. We like to do skin to skin. We call that the golden hour, where the baby is just on your chest. We try to get the baby latched on right away. Some babies will actually crawl to the breast, which is awesome. And we try to get that baby latched on. Your labor and delivery nurse can help. And certainly once you get over to mother baby, your nurse can help. And also there's lactation consultants over there. Really, really important takeaway. If your baby is not latching, we want to start hand expression every 3 hours. We want to drive in that milk supply, protect that milk supply. The nurses are trained on hand expression. What I would really encourage you guys to do is to learn that technique before you go to the hospital. Listed here below is one of the videos that you can watch. If you don't get a chance to do it, we can certainly teach you. And if your baby needs to go to the NICU, 100% we have to get that pump in the room and your nurse will actually get you pumping with that. So that is a really important takeaway. All right. Breastfeeding. Oh, is that you, Em?
I think it's my turn.
Okay, have fun.
Thanks. All right. So we know there are a lot of myths out there. There is a lot of talk about, what you should be doing. Social media, I joke, is job security for me. So we do caution, as Kelly said, to be very careful about what you are taking away from social media. I once had a mom come in who was pumping and freezing all her milk and then formula feeding the baby. And I said, why are you not giving back the milk you're pumping? And why are you putting it in your freezer? And she said, TikTok told me my freezer had to be full of breast milk. So it's such a good reminder to me that there's so much out there. And as a new parent, it's information overload. So these are some of the kind of myths and things that we see and hear a lot in the clinic. Breastfeeding or pumping will be painful. I can't tell you the number of times I have moms come in and they were referred to us, and it turns out with their first baby, they pumped or breastfed, and it was painful the entire time. And they just assume it's supposed to be painful. Or moms who come in and, it's their first baby and they're having no pain with latching, but pain with pumping, and they just assume that's the way it's supposed to be. If you are having pain with feeding your baby or getting milk, something is not right. So we can help navigate that, or someone should work with you to figure out why you're in pain, because it should not be painful. There's some thought that babies who breastfeed lose more weight. That is not true. Sometimes when babies are first born, if they're exclusively breastfeeding compared to a baby who's formula fed, they will lose more weight at that time, possibly. I always say it's Mother Nature's cruel joke for our first time moms that there's no milk for 4 days. with a hungry baby as a first-time parent. So there is a time period where milk is not in, but the good news is babies don't need a lot of volume at that time. So not necessarily true that babies will lose more weight if you breastfeed them. I think the biggest concern I see, especially as I talk to moms as they're preparing for delivery, is that they're not going to make enough milk for their baby. And unfortunately, I think a lot of that comes with social media. I never, ever even had that thought when I had my babies. I was like, I'm going to breastfeed. So there are certain conditions and certain interventions and certain things that can decrease the likelihood of making a full supply, but it's not a super common thing. I mean, we see it all the time in the clinic because we're a specialty clinic, but there's not reason necessarily that you won't make enough milk for your baby. And the good news is, as Kelly said, your delivery nurses, your postpartum nurses, they're going to help you and get you on to a good path. If they don't, then this is when it's really important that you reach out for additional help. If my baby doesn't latch well in the hospital or shortly after discharge, they will never latch. Not true. We see lots of babies who come in, and what we want to see with a baby who's not latching is that the baby has been fed, and whether, it's usually a bottle once they go home, and that the mom has protected her supply. So if you're in the hospital and your baby doesn't latch at all, no worries. We will most likely get your baby latching. I think I can get babies latched 99% of the time, probably, as long as I have a baby who's strong enough because they're not dehydrated, and a mom who has milk because her supply has not gone away because she hasn't done breast stimulation. So we'll get that baby latching. This one, super common. I couldn't breastfeed my first, so I won't be able to do it with my second. Not necessarily true. There's so many reasons that people aren't able to breastfeed a child, and it's usually something that could have been addressed at least, and then making an educated decision about whether it was right or wrong. I know there are people who absolutely cannot breastfeed their babies, and I know it can be very challenging, and there are times where not breastfeeding is the absolute right choice. If you couldn't breastfeed your first and you want to be able to breastfeed your second, it can definitely happen, and you can be very successful with it. I need to have a freezer full of pumped milk. I think I've addressed this one. If you have a baby, we just need to feed your baby. You don't need a freezer baby also. I think it's important to remember, if you're going to be away from your baby, you only need to have enough milk to feed your baby tomorrow. So keep that in mind, especially if you're someone who's already back to work and you're concerned about supply, or you're thinking about going back to work soon. You only need to have enough milk to feed your baby tomorrow. And then finally, we see this one a lot. Bottle feeding or pacifiers will cause nipple confusion. I don't tend to buy into the nipple confusion. I think there are a lot of different reasons babies will or won't latch, and working with the right providers we can often get a baby latch. So there is a right time to give a bottle. There is a right time to give a pacifier. And some parents make the informed decision to just bottle feed, formula, breast milk, and that is absolutely fine too. My computer sometimes wants to advance and sometimes not. All right, so challenges. As Kelly said, there are a lot of challenges, bumps in the road that can potentially happen. If you're one of those people who your baby was born and latched and breastfed beautifully, lucky you, because there is an entire clinic here in Southeast Michigan that is busy 5 days a week for the challenges that occur with breastfeeding. One of the first ones that you'll probably experience, or experienced if you already have your sweet baby, is engorgement. This is the milk coming in. And as I mentioned, it generally happens around day 4 as a first-time parent, and around day 2 or 3 as a second-time mom, is when your milk comes in. Shortly after that, you often become very engorged, meaning your breasts become very hard, full. Sometimes it's even hard to get the milk out. The baby sometimes won't latch. We see a lot where moms will say, my baby latched fine in the hospital, and then my milk came in and now they can't latch. Super common. The breast just gets so full and hard that it makes it very challenging for the baby to latch. Things that can help with that: ice. Ice is going to be your number one thing anytime you have any breast pain, breast discomfort. It used to be heat and massage, and I'm going to cover this in a moment, but ice will help with engorgement. A supportive bra will help. And then doing some hand expression, as Kelly mentioned. Sometimes hand expression can work a little bit better than even a pump with engorgement. If you're trying to latch your baby and your baby won't latch, we'll sometimes have you do some hand expression just to soften up that area so the baby can then latch. Another challenge we see a lot in the clinic is nipple trauma. Again, breastfeeding and pumping should not be painful. So if you have any form of nipple trauma, it is generally related to a pump. But there are obviously moms who have nipple trauma from a baby who doesn't have a great latch or is kind of latching onto the end or has some type of suck dysfunction. So there's a lot of different reasons that moms can have nipple trauma, and you shouldn't persist. You shouldn't have to push through it. We want you to make sure you are reaching out to those people who can help you with that. And then finally, poor latch or no latch is one of the biggest things we see in clinic, and I know they see in the peds offices too. As I said, if your baby won't latch or is not latching well, you need to connect with an IBCLC for assistance. Most likely we can troubleshoot, and a lot of times it's just changing positions. Actually, this baby in this picture, I feel like is not in a great position to maximize milk transfer. All right, as I mentioned, some of the big challenges, and I'm sure you guys have all heard of this, and those of you who are on here may have experienced this, is a blocked duct or mastitis. And what this is inflammation within the breast. And I could probably talk for an hour on this, so I'm going to keep it super brief. And if you have more questions, put them in the chat. You can also reach out to a provider if you feel like you are dealing with this. Blocked ducts is some type of inflammation within the breast. So if you think about the way milk moves through as roads, the inflammation is the land surrounding the roads kind of becoming bigger and making the roads smaller. And so then the milk doesn't move through as easily, and you then get these lumps or bumps and some discomfort. So what we need to do, just like we would in any part of the body where you had inflammation, is ice, ice, ice. And I always tell moms bags of frozen peas. They sell ice packs for the breasts. They're like blue or purple and they're about this big. And they get warm really fast. So again, things not to purchase. I wouldn't purchase those. I was joking with a mom today that she can use them for when her 2-year-old has a boo-boo that's not really there. So bags of ice, you want to get good ice on your breast to help with this inflammation. And then Motrin and Tylenol, just like you would use if you twisted your ankle. The internet will tell you heat and massage. This used to be the recommendation. Many people will say, well, it helped, but it doesn't help the root cause, which is that inflammation. So avoid heat and massage at all costs. Another thing we see quite a bit, which is related to blocked ducts and mastitis, are blebs. And in this picture, you can see it's this white pimple-like thing. This tells us that there's some inflammation going on within the breast. So anytime we see a mom who has this white pimple, it's like, oh gosh, what's going on inside? And we can treat the bleb, but more importantly, we need to treat what's inside. So don't pop it. You're just risking introducing infection into that duct. We need to address the underlying inflammation, so ice, ice, ice. And then there is a steroid cream that a provider can prescribe, which will help take care of it pretty quickly. If you're one who's more prone to blocked ducts and mastitis, then we need to figure out what the underlying cause is. Sometimes it's a bad latch. Sometimes it's a change in a baby's schedule where they're feeding more frequently or sleeping longer at night. And some women, we were joking, not joking, we were talking with a mom today. She's about her. She couldn't even go an hour longer between feeds without getting inflammation. So some moms never get blocked ducts and mastitis, and some are very prone to it. So we want to figure out why you're getting blocked ducts or mastitis. And usually it's related to a schedule, a pump not working effectively, improper milk removal, a bad latch. Hands-free pumps tend to do this with some frequency. So if you're experiencing any of these things, you definitely want to reach out and get some medical attention. All right, the question of the day probably is, can I give my baby a pacifier? There's a lot of talk about this, and the biggest thing is we don't want to pacify feeding cues. So anytime a newborn within around the first 2 weeks or until breastfeeding is well established, anytime they show any type of feeding cues, they should be offered food. We don't want to pacify their need to eat. Because what can happen is if we're pacifying their need to eat, then they're not going to be demanding their food at the breast or via the bottle, however you choose to feed. And then you get into this cycle of the baby losing weight and maybe having more concerns with jaundice, which is that yellow coloring in the skin. It can make babies very sleepy. Then they're not demanding to eat. And then mom's milk supply will drop. So this will then lead to the need for more supplementation. That being said, we absolutely support the use of pacifiers once breastfeeding is well established and the baby is on the road to weight gain. So usually around 2 weeks, there's always cases where, there's exceptions to be made, or a parent may say, I just want to give a pacifier. So as long as you've had good education, understand the use of pacifiers, then it's reasonable to introduce them. The American Academy of Pediatrics, which Kelly referenced earlier, actually recommends pacifiers to help decrease the risk of SIDS. That being said, it's not as if you have to constantly pop in the room and make sure they have their pacifier in their mouth, but a baby who uses a pacifier with sleep has been shown to decrease the risk of SIDS. So I hope that makes sense. I know we get a lot of questions around that, especially in the hospital. They will discourage you from using a pacifier in the hospital, but feel free to ask questions. And, we want to make sure you have a good understanding of the reasoning for that. If you need a pacifier and you have a baby who's having any breastfeeding difficulties, we do often recommend the one in this picture. So that's why I threw that pacifier up there. Just has a little bit of a longer nipple on it. All right, so if you remember nothing else from this presentation, there's 3 things that we want to make sure we work with you on to keep in mind if breastfeeding is your goal. The first thing is protecting your milk supply. And this doesn't matter where you are in your journey. In the hospital, if you have a baby who's in the NICU or not latching, it's going to be really important that we start taking the milk from you and getting it into your baby. And if the baby can't do that, then we're going to have you hand expressing and pumping to protect your milk supply. If you come in on day 5 and you haven't done any pumping, it's going to be much harder to get that supply built back up. If you're a mom who has a baby and the baby starts sleeping 12 hours at night, I had a mom call me today and her baby's sleeping 12 hours at night. That is not recommended also to not do any type of breast expression because we're not protecting your supply. So we always want to make sure we're protecting your supply. And that can be pumping if you have a baby who's not latching, or making sure you're getting that good frequent breast expression. Number 2, feed your baby. If you have a baby, let's say who's a couple months old and they are on a breastfeeding strike, we need to still feed your baby. If you have a baby who's in the NICU and won't latch, if you have a baby who's a 37, 38 weeker, who's just a little bit more on the sleepy side or jaundice side, we need to make sure they're being fed. We can always work to get the breastfeeding back together as long as we have a supply and we have a healthy baby. And then 3rd, call for help. Like I said, if you have the milk, it's likely we can get your baby latching or relatched. Returning to work. This is another one we get lots and lots of questions about and is very stressful for parents. There's so much that comes with returning to work. Who's going to watch my baby? How am I going to feed my baby? Who's going to feed my baby? When am I going to pump? Where am I going to pump? So it can be very stressful. And if you are pregnant, I would say don't stress about it right now. If you have a brand new baby, I would say don't stress about it right now. If you're getting ready to go to work in the next couple of weeks, then I think it's important you really are planning for this. In general, you want to pump about every 3 to 4 hours while you're away from your baby, just to protect your supply. It is the law that you are to be given a place to pump that is private, is not a bathroom, and you can pump or express milk for up to a year after childbirth. And again, you also are allowed to breastfeed your baby anywhere that is, anywhere you choose. So there's no rules about you can't breastfeed here or there. But returning to work, it's important to have a good pump, a way to store your milk. And for those of you who maybe are pumping at work or are pumping a little bit more at home, I'm going to share a hack with you. You can just take your pump parts and you can put them, after you finish pumping, put them in a clean plastic bag and throw them in the fridge. You do not have to wash them while you're at work, and it is safe as long as they are refrigerated. And then I always recommend once a day doing a good washing of your pumps. Soap and water, dishwasher are all good options. So you're pumping, there are many people who choose to pump only or to add pumping into their feeding routine. And I give huge kudos to any mom who exclusively pumps. It is a full-time job, and it can be more stressful than just breastfeeding a baby. But many people, this is their option or their informed choice, and we are here to support whatever that looks like. Some parents choose to exclusively pump and bottle feed their baby. Some choose to never use a pump. I've had moms come in and they're like, I don't own a pump. I'm never going to use a pump. And we'll support whatever that looks like. However, going back to the previous slide, if you're going to be returning to work, I highly recommend offering a bottle by about week 3 to your baby, and ideally once a day. I have many stressed parents who come in or call, and I've seen it over the last 20 years. I've had coworkers who've done it, and the baby won't take a bottle, and that is really stressful on both the parent who is returning to work and the parent who's probably staying home with the baby. The daycare providers probably aren't going to be super stressed about it because I think they deal with it quite a bit, but it can be very stressful for family members. So I do recommend giving a bottle at least once a day, starting at week 3. Anytime you give a bottle, you do want to pump. Some people will pump to assess or ensure adequate volumes. There are people who make not quite enough milk to feed their baby, or who are called kind of what they self-refer as just enoughers. And sometimes doing an additional pump a few times a day will give them just a little bit more milk. Sometimes we'll add in pumping if we're trying to build up a supply. Pumping, I think, is great, especially in that newborn time period, so moms can get a little more rest. I often will tell moms, why don't you pump once or twice overnight, especially if they're exhausted, and let dad get up and bottle feed. It's much quicker than getting up and changing and nursing and doing all of that. So I think it's a very probably underutilized recommendation for many parents, especially in that postpartum fatigue phase. Some people will pump after feeding to build a supply or to store milk. And as I mentioned before, we just want to caution about feeding the freezer. And it can also cause an oversupply in milk, which can then cause blocked ducts and mastitis. And mastitis can sometimes cause a decrease in your supply. So it's a fine balance, and it can be tough. I have many moms who say, I want to pump to build up just a little bit of supply. And at that time, I know Kelly and I both recommend pumping once in the morning after your first morning feed. You're going to have most milk overnight and into the morning hours. So that's a good time after you feed your baby in the morning to pump. I always say you get more bang for your buck by doing it at that hour versus later in the day or the evening times. And then finally, there are some moms who choose to pump because the baby will not latch despite your best efforts and despite our best efforts. And, as Kelly mentioned in the clinic, we will spend all the time you need on pumping, flange fitting, going through the cycles, like she said, giving you a paper that'll talk through the settings. So we want to make sure you feel very confident in your pumping journey if you are one who decides to pump, or if you have a baby now and you're like, I hate pumping, it's so painful. You need to be evaluated so we can make it not painful. As we said, it should not be a painful process. All right, storage of human milk guidelines. First of all, if you deliver at Trinity, you will get one of these magnets in your newborn binder. If you are in our clinic, we have them also. You're going to have this, you'll be able to screenshot it in the recording, but this just is a guideline that will, I always say, keep it on your phone, keep it with you. If you have the magnet, put it on your fridge, just to help you keep straight of how long can fresh milk stay out? What if I thaw it? What if I freeze it? How long can it stay in the fridge? And this is just nice because it can be very confusing. So you will have this chart, reference it, and like we said, if you deliver at Trinity, we actually now have a magnet that has all of this information on it. All right, so now you've protected your supply, you've fed your baby, but things are still not going well. What do you do? So, as Allison mentioned, Kelly and I both are providers over at Breastfeeding Medicine. We are in the Reichert building, adjacent to St. Joe. We are open pretty much Monday through Friday. So, on this screen, this is our entire staff. We are a very intimate, close staff. And after 20 years in primary care, I'll tell you, I'm never leaving this clinic. It is fabulous. We have the most passionate, caring people. And I love that every day parents thank us for what we do and really, really make a difference. So, Lisa Hammer is the brainchild behind the Breastfeeding Medicine Clinic. Many people, as they are talking about breastfeeding medicine, will say, Lisa Hammer, Dr. Hammer, go see Dr. Hammer. And we are so happy and proud to be part of her dream. She, however, has a son who is an Olympian. So she spends a lot of time traveling with him right now. And so she's on a very contingent basis in the clinic. Dr. Langton is a DO, so she sees patients about once a week in the Ann Arbor office and about once a week in the Brighton office. She's the only provider in Brighton currently. And she also does OMT. You know, Kelly and I. So those are the 4 providers. And then we have 2 full-time fabulous RN, LPN, IBCLCs. Nancy Dimitrachina, she's also our baby-friendly coordinator at St. Joe, or Trinity Health. Trinity Health is a baby-friendly accredited hospital, and there's a lot that goes into it. And she and Beth are mine and Kelly's right hands. They are fabulous. So if you call the clinic, yes, and you need to talk to a nurse, you're probably going to get one of them. We have a couple contingent nurses who work very, very part-time when we let Beth and Nancy have a vacation. So this is our clinic, and the phone number's there. If you deliver at Trinity, they will put a referral in if needed, or they'll provide you with the information. We see lots of moms from U of M, Henry Ford, Corwell. So we will see you wherever you may be. So what do we do at the Trinity Health IHA Breastfeeding Medicine Clinic? We do a lot. First of all, our appointments are about an hour and 15 minutes. It's an appointment for mom and for baby. So we're in both of your charts, and we provide care to both mom and baby. So we do comprehensive lactation care for the mom. We can work with high-risk moms. So we'll do prenatal consults. We're seeing more and more of those, which is great because we can talk to you about the pump and what things to buy, what not to buy, do a physical assessment, kind of talk about how to get off to the best start, address any concerns, issues you had with previous pregnancies or breastfeeding journeys. As I mentioned, pumping assistance and fitting, previous feeding difficulties, moms with low supply. There are a variety of things that we can do to work with low supply. Because we are a medical clinic, we can also order labs, we can order cultures, we can do a lot more things than if you're seeing primarily a IBCLC. Because we have the provider support within the office, we can do a lot more things than most other lactation consultants. We deal with any type of birth trauma. We actually had a baby who was having difficulty latching, super, super fussy. And we were able to determine that the baby had a broken clavicle. And, that was a birth trauma, but it affected the feeding patterns for this baby and for the mom. Anyone with nipple issues, breast pain, acute or chronic diseases, and then breast surgery and trauma. Anyone who has had any breast surgeries, trauma, injury to the area, piercings, will benefit from getting some additional help because that can impact breastfeeding in a variety of different ways. And then our babies. So any baby who's born prematurely, they generally leave the hospital not ready to breastfeed. Any babies with poor weight gain, we see lots of babies who come in for slow weight gain or poor weight gain, latch issues, tongue tie. All the providers in our office can clip a tongue tie if needed. There's a lot of talk around tongue ties, so we will discuss at length and make an informed decision together in terms of, is the tongue tie affecting feeding? We work with babies who have chromosomal abnormalities, and actually one of my nurses diagnosed a cleft palate in clinic after the baby had been at a hospital for almost 2 weeks and it was not diagnosed. And then Dr. Langton does osteopathic manipulation. So we do lots of different things. All that being said, we know we are not the only IBCLCs in the community. We also have many fabulous IBCLCs within IHA. So if you are going to an IHA pediatric office, you may be offered an appointment there, and that's great. Kelly provides some hours at the West Arbor one. The concern is that if you're not an IHA patient at that office, it's often hard to get scheduled. And they have very limited availability just because they're dealing with everything else from cold to flu to, you know, sports exams to well physicals. So it's just, they don't have as much time built into their schedules. But sometimes when you're discharged from the hospital, they will suggest that you can make your appointment at your home office. So I've put all the names of the IBCLCs within IHA. And again, you'll have to call to see if they're able to support you at the time you need it. But we love them all and we work very closely with all of them. And last but not least, you've had your baby, you're breastfeeding, you know where to go if you're having problems, but where do you go to just talk to other moms who are breastfeeding? Because this is hard. Like, what clothes do you wear when you go out in public? And what do you need to pack? And how do you pump? And all of that stuff. So we have a breastfeeding support group at our breastfeeding medicine office in our conference room that happens the third Tuesday of every month. And we had a great turnout yesterday. And it's fun because it's just a place to meet other moms. The babies can feed while they're there. You, of course, bring your baby. One of our nurses kind of moderates it. And anyone is welcome. You do not need to pre-register. You can just show up. So if you are anywhere in your breastfeeding journey, feel free to stop on in. We would love to see you. And that's it. That's kind of our wrap up of your breastfeeding journey. And we would love to open it up for questions now. And Kel, if there's anything else you want to add that I may have missed, let me know. And the storms are moving in here in Ann Arbor.
Same. I'm like praying we don't get kicked off here. So you just please carry on without me. So yes, we definitely are ready to answer questions. So if you'd like to ask one, you can put it into the Q&A feature, which is at the bottom of your Zoom screen, and look for that Q&A icon. And with that, we'll kind of kick it off. So the first question is around silverettes. If you don't recommend silverettes, what do you recommend for nipple pain? And I'm wondering if maybe you can just do a quick review on what a silverette is and maybe what people use it for.
You want to take that, Kel?
Sorry, I was trying to unmute. Sure. So a silverette is basically literally this little piece, I think it's made out of nickel, that moms purchase. They're sort of out there saying that, you know, it can help with nipple pain, trauma, things like that. And you put them over your breast and then you kind of put the bra over it. The problem with them is that if you are engorged, as Emily was talking about, you have a ton of inflammation in the breast. And, you know, by putting that silverette on and then putting more pressure in there, it can cause more inflammation and trauma to the breast. That's one problem with them. And then just to get in a little bit more detail, if you have any kind of nipple wound or trauma, which we do see, unfortunately, it can be from the pump, like Emily mentioned, or sometimes the baby did not have a great latch initially. And, you know, we see moms that come to us with bleeding nipples. If you have that and then you put the silverette over it, you have a wound that is trying to heal in a moist, dark space. That is not recommended. And then milk is just pooling there. So again, we have definitely seen it lead to infection and track it back to that. What we do recommend to answer the second part of your question is a nipple balm. So we like the Earth Mama, Mother Love. In the hospital, I will tell you this, as a hospitalist up there, we do provide, the nurses provide, or the hospital provides lanolin or Pure Lan, and that's okay. You can use it during your hospital stay, or guess what? If you want, you can bring your own to the hospital. The Earth Mama is a little pink tin can. You can order, you can get it at Target, you can order off of Amazon. Moms seem to love it. we like it. It's really good. And I think the one we have in the clinic is Mother Love. So again, that's not, I mean, other moms have said I'm using X, Y, and Z and it works great. That's fine. But like I said, the Silverettes are about 60, maybe more in terms of price. And we just don't think they do any good. In fact, we think they sometimes can do harm. Did that answer your question? Oh,
Also, to add on to that, if moms are having significant nipple pain and you're like, I need something to put over my nipple because it's rubbing on my bra, there are things called hydrogels, which are absolutely fine. You can order those online. Those are fine if you just need something to prevent your nipple rubbing. But again, we need to get down to the bottom of whatever's causing the issue.
Okay, great. Do you recommend a consult prior to delivery for inverted nipples?
I'll address this one since I talked about the complications and concerns. It's never a bad idea because we can talk to you about what to look for. And oftentimes inverted nipples are not necessarily truly inverted, but we definitely have seen moms with inverted nipples, and we can talk to you about ways to prevent getting sores in those areas and to maximize latching. So I think it would make sense to do a prenatal appointment if you have any concerns at all. Even if you're just like, I don't know, I don't even know how to turn a pump on or what pump to order. We even have one of those like baby-born baby dolls in our office that we can work with you on latching and holding and positioning. So I never think it's a bad idea, but if you have any concerns going in, I think it makes perfect sense to call us and get an appointment.
Okay. This person says, I'm 36 weeks. When should I be able to produce colostrum?
This is a great question, and one that we have to defer you back to your OB on. Some moms are told that they can start pumping or hand expressing to bring colostrum to the hospital. But your OB has to determine that. That is not anything we can give you advice on. Even if you harvest colostrum and you have it ready to go when you come to the hospital, that first latch is going to be what has 10 times the immunity, and you're going to have more volume there than any other time of the colostrum. So you're still going to want to do those first latches and get milk coming in when you have the baby. But if you're one who's interested in pumping before or hand expressing before, just give your OB a call.
Okay. Do you recommend use of a Haka in the 38th week? And it says to store gold liquid. I'm assuming that's the colostrum again we're talking about.
I'll do that one. We do not. We are not fans of the Haka, regardless of when you are using it, just because it is that constant suction, which can create more inflammation to the breast, doesn't allow any rest there. If your OB allows you to start collecting, we would recommend probably just hand expression, or if they say you can pump, use a regular pump, please.
Okay, so question about overnight expression. How often would you recommend expressing milk overnight if the baby is sleeping in 3 to 5 hour stretches? And should we be expressing less often overnight or continue that same frequency of pumping around the clock?
Okay.
Go ahead.
Go ahead, Em.
I was going to say, this is a great question. And we generally recommend that you are having some breast expression overnight. Part of it depends on how old your baby is. I mean, if they're like 10 months old and they're breastfeeding a couple times during the day and doing great with solids, whatever, you don't need to get up in the middle of the night to do anything. If you have a baby who's sleeping 3 to 5 hours, great. I think at that 5-hour mark, it's perfect to get up and breastfeed. If you have a baby who's young and is sleeping long stretches, or dad says, I'll just feed overnight so you can get some sleep, or a family member does, I always recommending doing no more than 1 4 to 5 hour stretch overnight. So if you have a baby sleeping 3 to 5 hours, I think you're golden, and just get up and pump when the baby gets, or feed when the baby gets up.
Can I add one thing to that? I just want to make sure, before you do longer stretches, you make sure with your pediatric provider, because like Emily said, it totally depends on the age of the baby. So generally speaking, we want you waking every 3 hours to either breastfeed and probably to keep that supply up until baby is past birth weight. And then your pediatric provider will likely say, guess what? You can sleep a longer stretch, like Emily said. So I just wanted to throw that in there.
Yep. Perfect.
And do you recommend that patients set an alarm to wake them up, or does your body sort of wake you up when it's time to pump?
Great question. So, like Kelly said, if your baby's not back to birth weight, definitely set an alarm. If they're back to birth weight and they're doing well, and generally they wake up about every 3 to 5 hours, then I would say don't set an alarm. If you have a baby who consistently is sleeping, 8, 10 hours, first of all, lucky you. Secondly, then yes, I would set an alarm, because what happens is your supply will go down over time. If you're not telling your body you need to have that milk, your body's going to downregulate your supply. And sometimes I have moms who are like, fine, I like my sleep. And if my supply downregulates because I get 8 hours of sleep, I'm totally okay with it. Fine. But if you're one who's like, no, I want to make sure I'm keeping my supply up, then yeah, you probably would need to set an alarm if your baby sleeps more than 5 hours.
Okay. And you did talk about pacifiers. Is there a brand that you recommend for moms to get before they make it to the hospital?
It's just the one that Emily put in the picture. It's the Soothie brand. Emily, do you know that's the brand, right? It's the Soothie.
It's the Avent.
Is it?
Soothie.
Okay.
Yep. And that's the one we like just because it has a longer nipple. And since we're talking about this, also, if you're thinking about getting bottles, which obviously we recommend, the bottles that have the longer neck nipples with the narrow long neck nipples are going to be the ones we recommend, such as a Dr. Brown, or Lancino. And I actually just read about a new one today that I have not seen yet. But what you want is that longer nipple, nothing that looks like a breast, because the bottles that look like breasts don't function like a breast in the mouth. So the longer, narrow neck bottles and pacifiers are what we would recommend.
Okay. And what are your thoughts on long-term use of nipple shields for inverted nipples?
Do you want me to take it on?
Sure.
Yeah, I think we do have this like thing that we say that you don't actually need nipples to breastfeed. You just need a breast. So I think couple things here. It's a tool in our toolbox. And do we use them? Absolutely. I have moms who would not be breastfeeding without a nipple shield. I have moms who have breastfed for an entire year with a nipple shield, and that's okay. Our goal is always to try to get the baby off the shield. Number one, it's kind of, you got to carry that thing around and keep track of it. Number two, preferred baby to be directly on the skin. But we, if you need it to breastfeed, it is okay. So usually what I do with my patients is if we apply a shield, I say, let's get that baby breastfeeding, happy at the breast and everything going really, really well. And then come back and we will try a feeding without it. And sometimes what we'll do is we'll start with the shield and then slip the shield off midway and see how baby does. But in no way are we anti-shield if we need it to breastfeed. It is okay. There are some concerns, like on the internet, of course, about decreased milk supply with shields. At least if you're in IHA Trinity, your baby is going to be followed so closely that we would know, because the weight would go down. You would say, I'm having decreased supply. We're on top of those things. So I personally don't worry about that. So the other thing that we say is if your baby is if you're using a nipple shield to breastfeed, you should absolutely be followed with an IBCLC. You should be followed by either somebody in that pediatric office with experience or somebody at the breastfeeding medicine clinic, just to kind of keep eyes on things. So, yeah.
That's a great question. One thing I didn't mention when we were talking about the clinic and things we offer, we always do a weighted feed. And so that means we weigh your baby, we have you feed on one side, we weigh your baby, and we can tell you exactly how much your baby has transferred because we have very specific scales. And then we have your baby feed on the second side, and we again weigh the baby. So it's really nice because we have actual data on how much your baby has transferred using a scale that is so precisely calibrated. And we can do a feed with the nipple shield and see how much they transfer. Then we can do a feed without the nipple shield and see how much they transfer. So like Kelly said, we'll watch you very closely.
And we talked a little bit about kind of like the sense of urgency. So if you're a mom struggling with breastfeeding, you want to be seen soon, right? And so you talked about sometimes if you're not established at a peds office, it might wait a little bit longer. How does that work at the breastfeeding medicine practice? Is it a pretty quick turnaround for moms?
Yes. So I was there today, so I'll just speak on even what this week looks like. As of this morning, we were full for the rest of the week. However, by the time I left this afternoon, we had 2 openings for Friday. So we try and get you in the same day or next day if it's urgent, which we definitely have those ones. We will work you in. Kelly and I are at the office, we're the providers there the most, and we will always work you in, whether it's over lunch or at the end of our day. If it's a pretty straightforward thing, then we'll work with you to find out what day and time works best for you. But generally, I would say we can get you in within a day or two.
Okay, and you talked about talking to patients on the phone. Do you offer virtual consults or visits as well?
We do. They're not preferred. At least I don't prefer them because it's really hard. I can't work on latching a baby. I can't assess your breasts. I can't do anything. So honestly, the only time I generally will do a virtual consult is if I have a mom who's maybe trying to wean the baby and she wants to know how to do it without preventing, without getting clogged ducts or mastitis. Um, that's probably the biggest one. I'll sometimes do prenatals, but again, I think it's better to have the pump in front of me, really work with you, do an exam so I can say, this looks like it could be a concern or this isn't, or that kind of thing. So they're not common, but if the need arises, we can.
Okay, yes, definitely sounds like more of a hands-on experience.
Yes.
Okay. If a mother's experiencing mastitis or any other type of issue, is it still safe to feed the baby, or to attempt to breastfeed? Are there concerns about the baby receiving any kind of infection?
I'll take that one. That's a great question. And the simple answer is you can still breastfeed your baby if you have mastitis, if you feel up to it. If you are really sick, you feel like you have flu-like symptoms, which sometimes that happens with mastitis, you have a fever, you may not want to, but there is no risk to the baby. And we do have a very specific protocol, and Emily already actually kind of went over it, but I'll just repeat it again. Number one, if you are feeling like you might have mastitis, please call us right away. We want to talk through that. We will probably see you. And the protocol for that, as Emily mentioned, is ice, Motrin and Tylenol together. And no extra stimulation to the breast, so you can feed your baby and or pump if that's what you're doing. But we don't want to be like adding extra pumps in or anything like that. Sometimes that protocol alone will allow you to sort of get out of this mastitis cycle and not have to take antibiotics. However, there are still some moms who will do that. And, in 48 hours, we're talking and following up, and they're saying, I'm no better or worse. And then we will send in antibiotics. But we definitely want to see you in the clinic if you are concerned at all about mastitis. Does that answer your question?
I think so, in my opinion. This is an interesting question. I've never considered this, but is it important to feed your baby pumped milk from the same time of day? Excuse me. In other words, so if a mom pumps milk at 2 a.m.
Are you still there, Allison?
Oh, yes. Can you not hear me? Are you able to hear me?
I hear you.
All right.
Okay. All right.
I have the question, Kelly. It says, how important is it to feed baby pumped milk from the same time of day? In other words, if I pump milk at 2 a.m., how important is it for us to feed that milk at 2 a.m. versus 8 a.m.?
Yeah, it's no specific time. You can feed that pumped milk anytime. Absolutely.
So they talk about, can you hear me now?
Yes.
Hopefully. Okay. Sorry about that.
No problem.
So you talk a little bit about like that, like the colostrum in the beginning. Is that sort of the only time throughout breastfeeding where the milk is really different in terms of like when you pump, how you pump, during the time that you're breastfeeding throughout maybe the first year or so?
Yes. So the colostrum is that first milk, usually in the first few days. And then there are, your body adjusts to your growing baby, but you don't have to be so specific that you can't feed your 6-month-old baby the milk from 2 months, or that it has to be within that same time period. So the biggest difference is colostrum to full milk throughout your breastfeeding journey. And just to kind of piggyback on this, many people will ask about hind milk and fore milk in terms of fat content. 99% of the time, it doesn't matter. So don't get hung up on, did the baby only feed from one breast and not the second? Did they get the higher fat, lower fat? Generally speaking, it doesn't matter.
Okay. Can you talk a little bit about vitamin D drops for newborns? Why and how would you administer those?
I can do that one. Okay, so breastfeeding, we know we love it. It's perfect in most every way. We're just a little bit shy on vitamin D if we compare it. So for every baby who is either directly breastfeeding or getting breast milk, so even if mom is exclusively pumping, starting around 2 weeks, baby needs 400 units of vitamin D per day. Now, I just want to clarify this too. Depending on the brand, that can look like 1 drop or 1 ml. So it's very important. Run it by your peds provider. We know all the different brands, whether you know it's 1 ml or 1 drop. There is one that we recommend that's the dropper one because it doesn't taste good. So babies don't really like it. So a couple ways that you can give it to your baby. You can directly put it right on mom's breast and baby can kind of just take it off with the feeding. You can put it on your finger and put it in the baby's mouth. Or if it's a day where the baby's going to get a supplemental bottle, you can drop it in the bottle as long as you know they're going to take that volume. This should continue every single day until the baby is 1 year and starts taking some cow's milk that has vitamin D in it, or your breastfeeding / pumping journey comes to an end. So I always give the example, let's just say at 9 months, your baby starts getting really distracted and you're like, you know what, I just think I'm done. You guys move to formula, you don't have to do the vitamin D anymore. So yeah, and that's all the pediatric providers are very well versed in this. So please feel free to review it with them as well. And you can get the vitamin D on Amazon, Target, Meijer, anywhere.
Okay. Is there a device you can use to catch your leaking milk that does not suction it out of the breast? Does that
I'll do it. Yeah, that's the ladybug collector. It's by Haka. It's not the Haka. It's called the ladybug collector. You can look it up. And it's just a passive collector, and that is completely fine. There's probably a couple other collectors like that, different brand names as well. But we are completely fine with that. Just no suction.
Okay, and then just a couple more questions if you can hang in there for another minute or two. Do you have concerns over C-section versus natural birth when it comes to breastfeeding?
You got it. I'll let you take that one just since you work in the hospital with these mamas.
Yes, absolutely. So I think the short answer is no. However, sometimes we do see with C-sections, mom might be more painful, or she might not be able to move around, or sometimes with positioning, we really have to be careful with the incision. So sometimes that can present some challenges, but you know what? There are so many people on that unit to help you with that. That's actually when I'm in the room and helping moms, that's one thing I use, the very first question, actually clinic or hospital. How is your tummy feeling? Are you still sore? Can we even put the pillow there? How do we want to do this positioning? But otherwise, I really don't see a difference, honestly. Vaginal birth, epidural, C-section, it all works.
Okay, fantastic. So I think we covered, I think we might have one more question. Let me just jump in here. Oh, this is a good question. How about when it comes to being induced? So if someone is induced, in this case, it looks like about a week and a half early. Will milk come in after birth? And how do you know if your milk will be ready?
That's a great question. And what triggers your milk coming in is the loss of your placenta. So that then triggers Pitocin and hormones. And so it doesn't matter if you're induced or you just go into labor on your own. The response is going to be the same and your milk will come in the same fashion. Sometimes inductions can be a little bit longer. So again, it just plays into how tired is mom afterwards. And it's okay to say, I'm exhausted. And then we'll get you doing some hand expressing and feeding the baby in other ways. But no, your milk will come in the exact same way.